That worked. Good morning, everybody, and welcome to the White Coat Ceremony for the class of 2025. It is so wonderful to see all the people that support these hard-working students, and I'm sure you're glad you get to spend a day with them because you probably haven't for the past 14 months, right? Let me start by introducing our faculty and staff of the PA program. We have Professor Robert Adamczyk, Professor Tiffany Eben, Professor Sama Jaramillo, Professor Wendy Rich, and the people who really do the work in the office, Joanne Pobuda and Aruj Ahmad. So let me introduce the Dean of the College of Health Professions and Human Services, Dr. Jim Konopek.
Thanks, Dr. Biscardi. Thank you, everyone. It's a joy to be here on this auspicious occasion for our PA students. I'd like to thank certainly our faculty and my colleagues here at Kane for helping to make this wonderful event happen. Thank you to friends, family, and guests who are joining us here on campus on this lovely rainy Friday. We're here for a very special reason. We're here to celebrate our students' passage into the clinical phase of their training. I also want to thank our keynote speaker, Mr. Hans Fontaine, who will be taking a break from cardiothoracic surgery to join us here today, so we'll let him get back to that after we're done here, not too long. Students, I know a lot of you are probably both excited and a little bit anxious about getting started on your clinical rotations. We know you're ready. But before you come up here and put on that white coat, I'm going to tell you and our guests here today a little bit about white coat syndrome. It has nothing to do with failing to put on the coat correctly when you're up here on the stage. You know white coat syndrome. It's also known as white coat hypertension, and for those who don't know, it's when you see an observable spike in blood pressure among patients caused by their anxiety in the medical examination room. Anxiety about seeing the person in the white coat. That white coat, it's symbolic. And I bring this up today to remind you as emerging practitioners about patients who can be so anxious to the point of acute hypertension and the role that you play in helping to put them at ease. Put yourselves in your patient's shoes always, because empathy is a critical skill for healthcare providers. Having had one of my own children admitted to the hospital earlier this week, I can tell you, just as most people around the room can eventually tell you if they couldn't already, that even for someone who kind of knows what's going on within a healthcare setting, being in that small room with the tubes and the wires and that uncomfortable plastic wristband and the uncertainty of that situation is stressful, both for the patient and for their loved ones. And so a little bit of compassion from a provider who's super busy and trying to get so many things done really quickly goes a really long way. It's a beautiful thing. Your patients, they will need to be diagnosed and treated, but they also need to feel seen and heard, and that in turn will lead to improved health outcomes. This is why the professional oath that you'll be speaking later on today, it's in the back of your program, it's so important. It's your promise that you'll make with sincerity and upon your honor to practice more than just non-maleficence, that is, doing no harm. There are some other powerful words in that oath, and when you speak them into being, I want you to think about that and those words, because I want you to read those things over and consider the spirit of them, because years down the road, like some of the folks who were just talking with before this ceremony, you're going to remember this ceremony, but hopefully the spirit of the words within the oath. Doing so and carrying those sentiments with you will serve you well throughout your careers and will make you truly excellent healthcare providers. So on behalf of the faculty in the College of Health Professions and Human Services, We're confident that you're going to succeed in your clinical rotations and your careers as physician assistants. Be just as confident in yourselves. You don't have to know everything yet. You'll learn a lot along the way, perhaps including about where you would like to work down the road. Remember, as you're confident in yourselves, be also confident in one another. Support one another through this last phase of your learning. And remember the trust and responsibility that comes with wearing the white coat. Thank you and good luck.
Thank you, Dr. Konopak, for those inspiring words. I'd like to introduce now Professor Eben, who will introduce our guest keynote speaker.
Hello, everyone. I'm so excited to see everyone today. I think I was just as excited to see all of our second-year class coming to this, so I'm very excited. I have a great pleasure to introduce our keynote speaker today, an amazing PA and really a specialist in our field. Hans Fontaine is a physician assistant specializing in cardiothoracic surgery and critical care for the past 12 years. He received his training as a PA in SUNY Downstate in Brooklyn and has practiced in multiple cardiac surgery programs across New York and New Jersey. He currently serves as the surgical cardiovascular lead PA for the Division of Cardiothoracic Surgery at Robert Wood Johnson Hospital in New Brunswick, New Jersey. Hans has developed an interest in changing leadership and healthcare administration since becoming a PA, and he is currently working on his MBA at the University of Wisconsin with a concentration in finance and healthcare administration. If we could please all give a warm welcome to our guest keynote speaker, Hans.
Wow, thank you so much. I'd like to thank Tiffany for reaching out. Thank you to the Keene University PA program faculty, and thank you to the Keene University, Keine University, I'm still being trained. The Keine University PA students, family and friends. Congratulations, you made it through the didactic year that everyone dreads, and you're about to go off on your rotations, and soon you'll be graduating, so give yourselves a round of applause. So I want to start with a quote by a French novelist and poet by the name of Victor Hugo. He said, "The future is known by many names. To the weak, it's unattainable. To the fearful, it's unknown. But for the brave, it's a chance." When I was accepted to PA school in 2007, I didn't realize that going was going to be the best decision of my life. Not only did I get to become the kind of provider that diagnoses and treats some of the sickest patients, I also got to be part of a young and evolving profession whose best years are still ahead of it. So, you know, PAs are still developing their place in healthcare. So what does it mean for you, the folks coming into the workforce? It means you're being given a chance to do something that's never been done before, a chance to explore, a chance to innovate, and a chance to redefine. It's you guys that are going to be steering the direction our profession goes in, and there's no telling what the future of PA is going to look like. Since I've been a PA, I've seen major legislative changes to PA practice. I've seen mass adoption into multiple specialties. I've even seen a professional name change. Not many people get to live long enough to see their profession's name change right before their eyes. As PAs, we've outgrown ourselves as just assistants. We develop programs, we run ICUs, we're CEOs and COOs, we're entrepreneurs, and we're policymakers. We are the frontline staff, oftentimes the first person a patient sees, and sometimes the last. PA school is the elder generation passing on what they know to the next. But what we know isn't all there is. Healthcare has a preference towards the physician leader. But I want you to know that PAs are a unique profession. The model and the quality with which you're trained, the age at which many of you graduate, allows you to become experienced providers at young professional ages. This creates an opportunity to pivot and learn new skills to help us address some of the challenges that extend beyond the bedside. Our physician friends, their roles are increasing in complexity, not decreasing. They're burdened with the task of bringing new therapies to patients, performing cutting-edge scientific research, and developing medical devices and procedures that help our patients. And we can join them in that fight. If that's your interest, you should join them in that fight. But did you know that only 20% of overall healthcare outcomes are due to those things? The majority of healthcare outcomes are related to other factors. Factors such as social, environmental, behavioral, education, the list goes on and on. And they can't be an expert in all of it. They need help. They need our help. And so you could think of physicians, although physicians are, they're the clinical leaders of the healthcare team. When you get out there, I want you to notice something. The PAs are the operational experts and leaders of the healthcare team. Oftentimes, it's us that are charged with leading the day-to-day management of patient care. And you can see that, we are often looked to help push forward different initiatives to help in the community and beyond. Physicians are like the engineers of healthcare. And so if you think of it that way, I'd like for you to consider for a moment to think of PAs as the designers. It's us that have the expertise to look at the scientific and technical creations of the engineer and turn it into something that's truly usable for the patient. Because while looking at scientific gaps can lead to new discoveries and therapies, it doesn't always address the gaps in healthcare delivery. When I look around the room, I see a lot of young faces. And you have a superpower, an advantage. You have a different perspective. Sure, you can develop something new like robot this and AI that, but you can also take what we have now and find ways to make it fit better into our healthcare ecosystem. There are a lot of professions in healthcare, and they all contribute in their own way, but we're still struggling to meet the increasing demands of our patients. And so if you were concerned, I'm here to tell you, there's plenty of room for you, and plenty of room for you to offer what you have. So after you leave here and go off on your rotations, graduate, and eventually become providers, that's when the real learning starts. And you're going to be challenged. Don't be afraid to be uncomfortable, because you're going to be told no way more than you're going to be told yes. You're going to hear all too often, we've never done it that way before. And you're going to ask, why not? Don't be afraid to fail. Wisdom comes through failure. The difference between somebody who succeeds and doesn't oftentimes is how they interpret and are impacted by failure. Babe Ruth once said, "Every strike brings me closer to a home run." Thomas Edison, he said, "I never failed. I just found 10,000 ways it won't work." The danger isn't that you're going to aim too high and miss. The danger is that you'll aim too low and you'll hit. So when you leave here, I want you to cast a wide net, broaden your minds, and ask yourself, what can I offer that the healthcare community needs. Look in yourself, look towards yourself and others around you to really find what those talents are. Don't assume that the people who came here before you have it all figured out. We're learning just like you. That's why it's called practicing medicine. So before you leave, I want to leave you with a final quote by Albert Einstein. It's a famous quote. You might have heard of it before. He said, "Logic will take you from point A to point B, but imagination will take you everywhere else." Once again, congratulations, and get ready for an exciting career ahead. Thank you so much, Kane University, PA students. I'm learning.
Lots of words of wisdom there. Thank you. Okay, so here comes the fun part. I would like to have Professor Adamczyk go to the end of the stage. Dean Konopek and Mr. Fontaine, if you want to participate, and that's fine too. And Professor Adamczyk's advisees, please rise and go get your coat. And we'll do this one by one. I can't see. Okay, first, Joseph Brodeur. Hope Buchan. Brianna Harriman. Angel Ibrahim. Oh, I'm sorry. Nazrin Jahan. Sreja Patel. Emily Fan. Brian Rosen. Kevin Val Carcel. And Nicole Vassallo. And now, could Professor Eben's advisees please come forward? Elizabeth Cancelleri. Matthew Elko. Gabriella Herbert. Emily Jefferson. Ruth Klebowski. Tyler Manlanget. Caitlin McTurnan. And Jessica Stavar. And now, Professor Jaramello's advisees, please come forward. Maram Asalia. Brian Chabala. And because we like her so much, I get to say her name twice. Angel Ibrahim. Eddie Mendez. Kari Milch. Nirojika Nimalan. And Laura Spiak. Okay, students, I'd like you to please rise and say your physician assistant oath. One, two. Before you sit, I want you to please thank your faculty. How about give them a round of applause? And turn around and thank all the people who supported you to get here. Okay, you may be seated. Thank you. At this time, I'd like to introduce Martha from the Graduate Student Government Association. Please come forward.
Good morning, everyone. My name is Martha Julimus, and I'm here on the behalf of the Graduate Student Government here at Kane. We work alongside the Undergraduate Student Government Association here to address any student concerns and to fulfill our goal of creating an enriching life experience, campus experience here at Kane. I would like to thank Joanne and Carol for inviting us to attend your white coat ceremony and to congratulate you all as you embark on your clinical journey. I currently work as a scribe for one of the RWJ locations, Trinitas, and I would like to leave you with some words from our very own PAs, one of our PAs, Natalie Rivera. She says, anyone could do a job, but it takes a special person to take care of others and to help them regain health, to have patience, to be friends, and to be social workers, to be family members, and to be visionaries in a profession that is only growing. Never lose your sense of hunger for being a lifelong learner and to always have empathy. With that, congratulations, class of 2025, and we hope that this little gift that we have for you today is a resource in your future works.
Well, that was very inspiring. I hope you keep remembering all the lessons that you learned today from experienced PAs, experienced academicians as our dean, and all the lessons you learned from your faculty. Never forget, it's about the patient. You may not always know something, but you always have a hand to hold for them. Embrace a look of empathy. Just listening is just as important as knowing a lot of things. But you will learn. It's going to be just as hard as didactic, but at least you'll be moving around and seeing patients and putting that all to practice. I look forward not to having to buy so much candy now for the office. But I wish you all the best of luck, and I know you'll do well. And we'll see you in about a month for your first exam. So, congratulations. At this time, we'd like to invite the family and friends to leave the auditorium, start enjoying our refreshments. We're going to take some pictures with the students, and then we'll have them back right in your arms. Okay? Thank you so much, everyone.